I just finished seeing patients in LA. I'm in the Torrance office. We've got our girls in the Mar Vista, Los Angeles office seeing patients. I just finished doing some under eye filler, cheek filler, and Botox. I had done the daughter a few weeks ago, and then her mom loved how her face looked, and so now the mom came, and I treated the mom underneath the eyes and into the cheeks and Botox for the upper face. She's going to come back, and we're going to work on lower face next. We always want to make sure that when we do cosmetic treatments, we're considering your full face, and we're thinking about how the face is aging. We're thinking about underneath the skin, where we're losing fat, where we're losing volume, where we're losing bone. And so that is the approach we take as cosmetic nurse practitioners, cosmetic injectors in our office at Jossie Skin and Wellness. So then our patients look natural, they look refreshed, they look like themselves and never overdone. I can show you patients. There's just some of them we have just like up on our wall, and they're before and afters. And so you can see like the patients look like themselves, they look refreshed, it's never overdone, and we treat all skin types, all skin tones. So those are just a few pictures. I have some more over here in one of our other rooms. Again, of just patients, different backgrounds, different ages, looking like themselves, looking fresh. So people will do different treatments, under eyes, smile lines, cheek filler, chin filler, Botox, lots of skin treatments that we'll do. We really focus on, hey Terry, I hope you're doing so good. And hey Kimmy, really focusing on just like skin health and hair health. Everything we do is safe for all skin types, all skin tones. We see a lot of people of color, as I showed you there. And I can talk through each and every one of those individual treatments and what the patients did. Let me see if my girl is on. Her name is Samantha, and I'm trying to see if I can invite her. Oh, there we go, invite. Let's see if she comes on. And then you guys will talk to you about what. Hi, Samantha.
How
are you? Can you hear me?
I can hear you, but I can't see you on the screen.
I see you. You're so beautiful. Hey, girl.
Can I
see anybody's
face?
Can you what?
Oh, there you are.
You got it?
Yes, hello. Okay, we did it.
That's Samantha. She is in our Vegas office. I'm in our Torrance office right now, and then we have team members seeing patients in our office in Mar Vista. So I'm in LA, she's in Vegas. She's just taking a break from patients. I just finished with patients from the morning time, and yeah, you were going to talk to us about the laser?
Yes, I was going to start talking about everything Airlace. So, with the Airlace Neo Elite, it's an ND-YAG laser, so it's gentle, but it's powerful, and it is cleared for a ton of different indications. So some of the top ones that we use it for, oh, so you got your laser right there, both using it today. Some of the top indications that we use it for is like acne scarring, hyperpigmentation. We can also use it for fine lines, wrinkles, texture, just so many different things like sunspots, freckles. So we like to use it because it's safe for all skin types and tones. And it really, no matter what our patients are having problems with, we can find a way to fine-tune this treatment for them.
Yes, Britt says she needs it. I love this laser, and like she said, all skin types, all skin tones. So I showed you guys some pictures of, you know, our patients and what they look like in our office. We see everybody, all ages, all races, all backgrounds. And so we really want something that is going to be safe for everyone we're seeing. Like she was saying, we can fine-tune this treatment and really gear it towards what your skin concerns are, your goals, and like what your baseline is. You can do this laser on its own, but when she's saying that we can, you know, dial the treatment in, there's different settings on it that we can do, but also we can combine it with other treatments that we have in our office, like our skin tint microneedling, like our hydrofacial, and the bio-refill chemical peel. So I love this laser, and I mean, if you see everybody in our office, everybody's skin is always glowing because we're doing all the skin treatments all the time.
It's so nice.
Can you tell us, Samantha, we talked about, you said the laser. I was just going to ask you a question. Oh, and it's cool because we can do it the same day, in the same time as like doing the natural filler, doing your Botox, doing your regular filler. So a lot of our patients are coming in on a monthly basis. That's what I wanted to talk about, the membership program.
Yeah, so the membership is great because you are going to be coming in for like your Botox or your filler or your Easy Gel, But we don't want to just do that. We want to make sure that your skin is healthy and glowing and looking great too. So when you do the membership, you can do like the Airlegs treatment every month, or you can add on other services like the bio-refill, the skin pen, or a hydrofacial. So then we can start stacking treatments. It becomes a more affordable option when you add on treatments that way. And so then we're taking care of all your skin concerns while keeping up on your other injectables as well.
Yes. Britt was saying, does the treatment have a recovery period? So with the laser, there's no downtime with it. So you do it, you have a pretty glow. Only thing is if we're working on the DPNs, so DPNs are those little like flat moles we can get on our neck, our face, our chest. I had a bunch after my pregnancies. People are like the Morgan Freeman moles. So we can zap those off. There's not downtime with it, but they look a little more prominent, like a little darker, and then they shed off over the next couple weeks. So there's no downtime. Hi, Sandy, hope you're doing well. But yeah, the membership, like Samantha was saying, you come in on a monthly basis, and then we choose which skin treatment that we're doing based on your skin concerns, based on what's going on, your goals. So you can pick, like she's saying, from the laser, from the skin pen microneedling, from the hydrofacial, from the chemical peel, bio-refill chemical peel, and then, like saying, you can stack them. If you want to be more aggressive or whatever, we can treat on different layers of the skin. So sometimes we're doing this plus the chemical peel plus microneedling on the same day. If somebody has, you know, acne scars that they're trying to really work on, we want to go a little bit more aggressive, that's when we can start stacking them, like she's saying. So people like that, you can just, hey, Justice, I hope you're doing so well. You can come in, and when we're doing these treatments, like, we can really guide you on, so you don't have to try to figure out what to do. We'll give you recommendations. You can tell us if you have a preference on, you know, whichever treatment, but it's like you have skin. Justice, I hope you're doing so great. You just have professionals. This is what we do. This is what we specialize in. And so we can help guide you in what treatments are going to be right. And we can pair that with the right skin care that you're going to do at home. So that's a big part of it as well.
Yeah, so you definitely have to be doing your skincare at home. So we do all the things that we can to help you out in the office, and then you got to continue it on at home. With the laser, one of the biggest things is you have to be up on your SPF, not just applying it in the morning after, like before you put on your makeup. You want to reapply it throughout the day. And the reason why is after treatments like this, you might be at more risk for hyperpigmentation. And so we don't want to put you at risk for having other with your skin. And we can prevent that just if you follow like the post-care instructions, which we'll give you detailed information about at every appointment.
Yes, exactly. I love it. What were you guys doing? You guys were doing some Easy Gel and Botox on like one of your last patients, I think. You were doing like full set of Easy Gel.
Yes, so we did like 10 cc's of Easy Gel, so we drew extra. We've been doing some Botox, and then we recently had patients who came in. They did the Airlace laser treatment first, and then did the Easy Gel as well. And they had no problem with, you know, combining the treatments and being really happy with the results that they got.
Yes, Justin, we're doing good. This is Samantha. She is our nurse practitioner, one of them in Las Vegas, and she's just excellent. And we both had a break from patients, and so we were just kind of like talking through some of the treatments that we're doing. I love seeing her, and I'm like, can you come on live with me? Okay, so she was talking about Easy Gel. That is the natural filler, and I have the whole system to show you guys here. We have all the same treatments in our different offices. So 3 offices, 2 are in LA, 1 is in Las Vegas. We're on the Summerlin side of Vegas. For me right now, I'm in the Torrance office, and then our other office is in Mar Vista, so part of LA. And they're seeing patients right now. I would have them jump on, but they're like, they're going. Okay, so the natural filler, this is probably one of the most like highly requested things that we do in the office. Natural filler is a filler alternative made entirely from your own blood, your body's growth factors, and stem cells. So when you come in, we draw blood from your arm, and then we spin it in the spinner, and it separates out your growth factors, your stem cells. We take that part, and then we heat it up in the heater so it makes a gel. It thickens it, and we cool it down, and then we inject that in the face. Wherever we inject it, your body's going to make new collagen over time. So it's a gradual thing. Gradually, your body will look a little bit more lifted. The lines won't be as deep, not as hollow, made entirely from you. So this is really nice for people that if they don't want to do traditional filler, If they want that collagen stimulation, more of a long-term investment in their skin, and they don't need that like initial like instant result, this is the way to go. And I love the natural filler. I have done it all over my face. Samantha was injecting it all over someone's face earlier, but I've done it under my eyes, my temples, my cheeks, smile lines, the corners of my mouth, around the lower face. I last did it less than a week ago, so I'm a teeny bit, I don't know, I was bruised the other day, like had a little bruising here and there. It's kind of settled down, but it heals really quick. And when she's saying she did 10 syringes worth, that meant that we get, so usually when we draw it, we get like five syringes worth. And these are the syringe sizes. Let me show you. So we fill up 5 of these and we can treat different parts of your face. So with 5 of these, usually we'll do like the under eyes. If they're really hollow, like yesterday I did a patient and she was really hollow, all 5 of them went underneath her eyes. Sometimes people aren't super hollow or sunken, and so then we have a little bit more and we can treat like into the smile line. So that's like a second thing. But you did 10, so she did double the amount when she saw her patient. And where did you guys treat?
So we did a lot of different areas. So we did the under eyes, we did the nasolabial folds, we did like the marionettes. She just was getting to the point where she felt like her skin was sagging. She felt like she was getting older and looking more tired, and just things were dropping. And so we used a lot more volume in the different areas, and I'm excited to see her results. As far as like her getting ready for the treatment, she was just making sure to stay hydrated. She was limiting like alcohol and caffeine beforehand. Also things like NSAIDs, just to reduce like her bruising and bleeding during the treatment. And then she said the blood draw was okay. She said she felt nothing. I just drew a couple extra tubes so that we could get the volume up to the 10 cc's. And then the injection process doesn't take long. Because we don't use preservatives, like this is truly all natural, we don't have all day to inject it into your face. So we go ahead, inject it, relatively quick into the areas that we're targeting. And then we just give you all the post-care instructions, and then you're able to go on your way. She did have some swelling. She's going to have some bruising, things like that. But like Janelle said, it's not too crazy. And then we're going to follow up in about 8 weeks, I think, with her. She's scheduled to come back to get her second session of the Easy Gel, which I'm excited about. We'll be able to reevaluate the treatment that I just did and then see where we want to put the additional Easy Gel.
Yay. So that's really important. Like she's saying, when we do this, we do it in a minimum of 2 sessions. So do some, have you come back anywhere from 1 to 2 months later. Hey, Kay, I hope you're doing so well. And hey, Tiff, I hope you guys are doing great. MP Tiff, I see that she's a nurse practitioner too. That's Samantha, nurse practitioner. I'm Janelle, nurse practitioner. I'm in LA right now. She's in Vegas. We're just talking through the different treatments that we offer in the office. But okay, back to the natural filler. We do it in at least 2 sessions. So spread them anywhere from like 1 to 2 months apart, retreat the same area. We're really trying to like stack those growth factors, those stem cells, so that your body has the best chance of making new collagen. I say like usually patients 20 to like 30s, they can do 2 sessions. If they're really hollow and starting to get like mid 30 plus, that's when I'll say do a 3rd session, like add on another one. So spread it about a month apart each one. And then give it a pause, let it have some time to get the results, and then we can always talk about doing more if you want. It can take up to 6 months to see the full effects from the natural filler. So that's something to keep in mind. If you want instant result, I'm like, this is not the instant, hey, Samantha, she's so great. This is not the instant result. So this is a gradual, gets better over time. When I very, very first did it, I did not see, I was like, I don't see any change. This didn't do anything. This is dumb. Over time, I'm like, dang, I don't look so haggard. I don't look so beat up. And I haven't had filler for 3 years. So I really like this. It's just a gradual thing. That's something to keep in mind. Sometimes people will come on here and they're like, I don't see any change. Like, I did it and it only lasted for 2 days. I'm like, that's not it. You saw some initial swelling. I'm not expecting that initial swelling and that initial lift that you see right when we finish to be the thing that is going, that's not going to be the result. It's going to gradually get to that over time. And so that's something we just really educate patients on. If you want instant, that's when we're going to go traditional filler. But remember, this one is for new collagen, wherever we inject it over time. And the younger, healthier patients get a better outcome. So I tell patients, like, if you're drinking, smoking, doing drugs, having a poor diet, and you're like mid 60s plus, like your body's going to have a harder time to make new collagen. So that's something we keep in mind as we're doing it. You've done it on your husband's face. Sorry, I'm telling his business. And when he took videos with us. You did his face and you did his hair too.
Yes, yeah. So we can talk about how it works for like the hair restoration and the whole hair restoration program. So he's getting older. He's starting to have some thinning, kind of in the front. And so we went ahead and drew his blood, and then, you know, we put it in the centrifuge, we heat it, we cool it, all of the things. And so I injected it into his hairline. He said it was a little spicy as far as pain, but it wasn't too bad. We didn't do any numbing, anything like that. And then we're hoping to stimulate new growth as far as his hair. So he's excited for that. He was happy to come in and get the treatment done. And then I also did his under eyes as well. So this is not just for females. Anyone who's having like thinning hair, or you're noticing areas of like hollowness, things like that, this is natural. It can be for you. And I think my husband liked it particularly because he could say like, this is all natural, and felt better about that.
I can try to see if I can turn on one of the iPads and show. We have some different, well, maybe they're on my phone, different before and afters for the hair. It works really well for stimulating that hair, those hair follicles to grow. We have an entire hair health program. One component of that program is doing the PRF, the natural injections into the scalp for hair growth. But we also do a scalp facial. So the scalp facial, you come in, we're deep cleansing like the follicles. We're trying to make sure that there's nothing blocking the follicles from growing. So sweat, oil, product buildup, like that can all block the hair from growing. So we're trying to clean that out, debride it, help bring oxygen to the skin, blood flow to the skin. And then we have different peptides that we're infusing on the skin as well in that facial. Right now the machine is covered up, but so that's like a relaxing thing. People really like that. They just feel like, oh, my scalp feels really nice. Like it just feels like airy in there. Like it just feels fresh. And then we do the blood draw right after, and we do the injections. So the injections, like you said, a little pokey, but people really see great results with that. I say do a minimum of 3 sessions if you're just noticing some initial thinning. If it's more, then if it's like more hair loss, then we're going to be doing 6 sessions, and you can spread those a month apart. So anywhere from 3 to 6. If it's more, you can keep going if you like. But around 3 months is where people start being like, I can see like the baby hairs coming in. It looks a little bit more dense. 6 months in, you can like visibly see on the pictures, like, wow. So we have some good ones of those, and we have some patients that like share their experience about it. So I'm very grateful for that. Also, if you guys have any questions anytime, please feel free to drop them in. Like, it's very rare that I can actually get one of our other providers and like, hey, can you have a minute and come on live with me? I love Samantha, and I get to see her when I'm out in Vegas a couple times a month, once or twice a month, but like she's holding it down over there, seeing our patients, and we're super excited. We chose Vegas as our 3rd spot because we see a lot of patients in LA that come to us from Vegas. And with the patients, what we hear consistently from the patients in Vegas is that they're like, we want somebody to do natural looking aesthetics. We want somebody that can focus on all skin types, all skin tones. Like, we see everybody, we see all the ages. And then again, really the natural result. They're like, I don't want to look super overdone. I don't want to look like I've had work done. Like, I want to look like myself. I want to look fresh. So that's what we hear, and that's what the patients are asking for, and then that's what they get. So again, I can talk through some of these patients that we have done. Hey Brie, hey God is good. Hey Jasmine, can the collagen producing injections also be used in the lips? Yes, you can. It's not going to be like super defined borders with the collagen. So that's something to know. Subtle on the volume. It's not like really big on the volume. So this is done with traditional filler. We can get like a little bit more definition, a little bit more structure on the results. Whereas with the natural one, gradually people will just notice like some of the lines don't look as deep. Their lips look a little bit more hydrated, subtle on the volume. But if you're like, I want my lips done, then I say go with regular filler. I have injected the natural filler all over my face, all over patients' faces. I've done every part of the face. There's not a part that I haven't treated. So same for Samantha. But it's just a little bit slower to see on the lips if you're like, I want my lips done and I want these crispy borders or something. Okay, let me see. And if you have other questions, please let us know. I'll talk through some of these patients and treatments we've done. Samantha, if you have anything like you want to jump in, just stop me at any point. And then, yeah, so again, these are some of our patients, and I have some over there I can talk through here. What we really focus on in the office is something called facial balancing. This is basically a customized approach to your face. We're talking about how your face is aging, how your features play together. We want to make sure that, you know, it's not just the lips that are dominating your face or just the cheeks. We just want to make sure things look harmonized when we're doing this. We're thinking about what's happening beneath the skin. Where are we losing fat? Where are we losing bone? Where are fat pads separating? So that's how we inject. We're not here to chase a line when we're doing your treatment. I think a lot of people, as they see their face change, they'll just tell us, I woke up and now I have these smile lines. And in my mind, I'm like, okay, that didn't happen. Like maybe now you're noticing it. And they're like, that's all I see. I just want these lines done. But for us who have studied the face, who've studied anatomy, we know that it's not just these lines that all of a sudden get deeper. We have lost volume and bone starting up in the temple. We lose fat here. These fat pads start separating. They start sinking and pushing down. So we know to get the most natural looking result, we're treating multiple parts of your face. We're not just, again, softening here. We can soften that line and make the line go away. But then if these cheeks are still saggy and then this line is soft, it looks a little weird. Like it just doesn't make sense to people. They don't understand what's going on. Like their face looks off. So when we're doing things like here is a person, this is Suji. I'm sure a lot of you guys have seen her online. We have worked together for some years. She came in wanting to just do lip filler. And I'm like, okay, we did that once. She came in again and we did that and Botox. And I was like, Sujia, it's not just your lips that are aging, but we want to think about the full face. And we have different views of her as well, but this is just the one we have here right now. It's not just here, you know, we have these lines at the corners of the mouth, the marionette lines Samantha was mentioning earlier. We got the smile lines, but also like, you know, fat pads are separating, starting to sink. Your lips are starting to dominate over the lower face. So we might want to put some support into the lower face and to like camouflage the jowls, help elongate the jawline. So we ended up treating, again, multiple parts of her face. We did filler into her cheeks in this lateral part to help give a highlight to her cheeks so the cheeks can look lifted. We softened the smile lines. We're not trying to get them all the way gone. Soften the lines at the corners of the mouth, the marionette lines. Did some into her chin to elongate the jawline and straighten the jawline out. You can see this little shadow here. See her chin is just a little bit more set back. So elongated the jawline, softened out the shadows. Helps having this lower face support helps to showcase her lips better. So the lips will start to look ducky if you just keep doing lips and they're like jutting past your chin. So you don't want that. So these are all the different areas we did. And then we worked on skin treatments. We've done the chemical peel, we've done laser, and then her Botox, yes, we're doing for like the forehead, for fine lines, around the eyes. And she has shared all of this. And I always say, shout out, thank you to our patients for sharing. If it weren't like for our patients allowing us to share their photos and share their experience, I'm like, people wouldn't know that, you know, they got work done. Like if you just see her walking down the street, you're not going to think she's done anything. You're just going to think she's a beautiful woman and she's aging gracefully. Yeah. That's the whole point, right? All of these people, I'm like, if you just look at their after, they just look fresh. They don't look done. And that's the goal. So, and I can talk through more and let me know if I need to stop or if you have anything. You just saw this patient with us the other day in Vegas.
Yeah, she's so cute.
So beautiful. We did some skin treatments on her.
Yeah.
Okay, you had something to
say, if you want to talk more, I feel like in Vegas, there is a lot of people they asked about, like the lips, especially younger, you know, like in 20s, 30s, things like that. But I feel like more people are starting to, you know, think about the chin projection and balancing that way. Do you want to talk a little bit more? You kind of mentioned it, but as far as, you know, the importance of thinking more about like the chin and the lower face and how we can balance that out, because that's the thing that we're seeing a lot in Vegas as far as not just doing the lips, but adding kind of that balance throughout the lower face.
Yeah, I think I think that people want their lips to just look juicy, and I'm like, that's really cool, but this does not make sense if your lips look so great. And then I had a patient yesterday, and I was talking to her about it. I was like, she's been seeing another provider for a long time. She's like, I want to see you now because I like the whole approach, and your patients look natural. You'd only done her lips, and then the corners of the mouth were like more downturned. Chin, I was like, your lips are starting to project beyond your chin. And so that's when people will say like it looks ducky. It's because like this is short. Let me see. So I can show you some different like chin projection. Chin is one of the biggest things that we do on the face. Like all these people, I'm gonna walk through. I'm like every person on this wall has done their chin and the other wall. So for her, if she just kept adding more chin, the chin is going to be looking a little set back. The lips are going to protrude past it. So then the lips look big. And she wanted to do her lips, and she did her lips. But we also did some into the chin to elongate that jawline. So here, primarily, like the features are fuller cheeks, fuller nose, fuller lips, chin set back. So if I just did her lips, they're going to dominate. They're going to protrude past the chin. It's going to look a little off. We talked about this one in her chin. I'm trying to make sure you can see. And then here's another one that came in. Can you see that, Smith? I don't know.
Yeah, I'm trying to see if I could get it up on the screen a little bit better, but I can see it. Yeah.
Okay. So she came in and also wanted lips, and we did her lips. They look beautiful, but you can see like it wouldn't be balanced. So we ended up also softening shadows underneath her eyes, kind of extends into the cheek. We did the lips. So the eyes, and then this little dip into the cheek is where we also went. When we do the under eyes, we don't just treat that line. We're thinking about the entire fat pad. So we're also hitting that shadow up laterally. So it looks a little bit brighter there. Did her lips, but also brought forward her chin. So now it's not big cheeks, big lips, short chin. We brought forward this chin, and it just, again, helps to harmonize and showcase the lips a little bit better. Here's another one with the chin. She came in, can you see? She did her lateral part of her cheeks because she's trying to create a highlight here. And then we did some into her chin to elongate her jawline. You can see the chin is brought forward. Helps us just kind of balance, again, her features before. More highlight was in her mid-face, her nose, her lips, and then this is set a little bit back. Christina has done, oh guys, right now she's getting ready. She's like a, what do you call that, like a bodybuilder?
Yeah, she has that competition coming up, which is super exciting.
She did one. She just finished one last week, and then she's doing another one in like 3 weeks. So this is our girl. I've been with her for a long time. Like I said, she's in Vegas, and she was over there, and we were doing some treatments on her. Samantha just did like a chemical peel on her a few weeks ago before her show. But we have done multiple parts of her face as well. Some into the lateral cheek to create a little highlight, her lips, and then also a subtle amount into the chin just to elongate that jawline and make things look straight. And she's still, like when she comes back, because we've treated her for a long time, like she came back and she was like, that day she came to clinic and she was like, should I do more lips? And we were like, girl, you look so good. Like, no, you don't need it. Like, we're not trying to do things unnecessarily. We want to make sure whatever we do, it makes sense and that nothing's going to dominate. Not one part of the face is going to be overfilled, overdone, basically. And we were like, no, I was like, do you like your lips? She's like, I like them. I'm like, is there anything that's bothering you? She's like, no. And I'm like, then let's not do it. Like, we're not going to do stuff just because. We want to make sure it makes sense. I'm like, we got some, oh, here's another good chin one. Her, also, you can kind of see hers is a little bit, we call it recessed or kind of like set back. So the chin here, she has more of like a fuller face in through the cheeks, her nose, her lips. And so we did some into her chin. You can see it softened out that little shadow, brought it forward, makes the jawline look smoother. A lot of people will also say, oh, it got rid of the double chin. Like, you took all the fat away. And I'm like, no, we didn't. But when we elongate the jawline, it kind of camouflages it. So that's a nice approach there. All of these people.
A little bit about like the timeline, post-care, things like that.
Oh, yeah. You want to tell us?
Sure. So with filler, right, you're going to have that initial like maybe swelling. With this one, you're having the volume, which is great, the projection. But then it's going to take, like 6 to 8 weeks to settle. So with everything, we need to give it time to settle during that timeline. Like initially, you're going to want to like sleep upright, not massage the area, go get facials, things like that. Again, you're going to have some bruising, some swelling. That's completely normal. But then you can come back in. We can reassess at like the 6 to 8 weeks and potentially add more if needs be. And then as far as like timeline for how long it lasts, it depends on the area that we inject the filler. But usually like 18 months, right? 2 to 3 years for timeline for how long you're going to see those results.
Yeah, I usually like exactly what you're saying. 6 to 8 weeks for like the full product to settle, like where you won't be feeling it. Around 2 to 3 weeks, majority of your bruising and swelling is done. So at that point, you have a pretty good idea of what it looks like. But like Samantha said, we just don't want to inject at that point. We want to wait to 6 to 8 weeks for that product to completely integrate, to mesh in with your skin before we inject again. I think that is, I know people will usually ask me on here, talk to us about filler migration. I'm afraid it's going to migrate. And I'm like, honestly, guys, when I hear those stories, I'm like, I need more information. But most of the time, it's people have done stuff too much, too fast. People will be like, I went in, I got my lips done, and then I went and added more in 2 weeks. And then I did it again in another 2 weeks and another month. And I'm like, whoa, you're barely letting the product swelling come down, let alone the product like mesh with your skin. And you just keep adding on top of it. Of course, it's going to look like it's migrated. When they say migrated, they're meaning it's like, oh, it's puffy above here. It's like moving around. I'm like, dude, it's not moving around. It's not. Like, this filler is going to stay where we put it. You've just done too much, too quick. And so I tell them, I'm like, in our office, we won't re-inject the same spot for 6 to 8 weeks. I'm like, even if they're like, I liked it when it was swollen, I want more. I'm like, I just know we've been doing this a long time. I've been doing this since 2013. I know if you try to go too fast, it's going to be pudgy. Has a way higher risk of just looking bad. So I'm like, go slow with it. Don't rush it. It's your face. We're not trying to mess around with your face. We want to have excellent outcomes. Like, that's just what we stand by. All of the team is super thorough, and like, everyone's just excellent. They just are. Everybody's just over the top excellent. We don't want a bad outcome, and so we know we're not going to touch that same spot for 6 to 8 weeks. Let it settle. It's easy to add. Yes, you can dissolve filler too, but we don't want to have to dissolve unnecessarily. So I'm like, if you just go slow, let things settle, easy to add, let it all mesh in. We can do more. We also want to be able to have like the full picture of it before we just keep poking on your face. And then, yeah, like you said, I tell people like 1.5 to 2 years that it lasts. Even at that point when people come back, some people are like, oh, that's still hanging on. Like, sometimes we have like different noses. I wonder if I can show pictures. I don't know if I can show pictures.
No, with co-hosting. Oh, maybe.
Let me see. I'm going to try. Let me see. Oh, this is one of our other nurses. I just saw her as I'm flipping through here. That's Claire, one of our nurses. She's amazing. And she's on here. She's a big creator on here too, guys. This was Christina. This was Samantha doing Christina's peel the other day. These are just some pictures I have on my phone. I will talk through, and I can click through different patient before and afters just to show you. I know I showed you some that are on the walls, but I like to just showcase. These are people that we see in our office. We see all skin types, all skin tones. We really focus on getting you a natural looking result where it's going to look like you. It's going to look fresh, never overdone. We are with our patients forever. So it's not like, oh, you get your Botox and see ya. Like it's not like a one-time thing. Like, we have these long-term relationships with our patients where we're with them for years and they keep just aging backwards. I was showing you her side profile earlier. You can see her from the front. They just keep looking like themselves, never overdone. We really want you to look balanced. Again, like, I just also like to show, because not everybody is treating all skin types and all skin tones, and that's really important to us, especially as women of color. But like, we just want everyone to feel beautiful and safe and seen and heard. Yeah. So that's like what we focus on in the office. We do everything from like under eyes, nose. She did her nose here. Under eyes, nose, lips, cheeks, chin. We do all the spots of the face. We focus on skin health, hair health, natural filler, the traditional filler, so all the things. But I do like to show those, and I like to go live, and me and Samantha will probably try to go live. We both have kids, so I'm always like, are your kids Are your kids
Are
chill?
they behaving? Are
Are
they
mine aren't. Yeah, so we never get to, and then we're usually someone said, "Why is she just sitting there? I want to see you full screen." I'm here, but I'm with Samantha. You guys, this is one of our nurse practitioners in Vegas, and you've got to see her. She also does virtual consults with me because I cannot see them all. And I'm telling you, like, I feel like the people love you more than me. I love it. I'm like, that's how I feel. I would, when I met her, I was like, dang, I would want her to treat my face. Like, you are so knowledgeable, and I feel like you listen. I feel like you're calm. I feel like you're just great at what you do. And then seeing you inject, I'm like really proud to work there with you, work alongside you. Um,
Sorry, I'm trying to look through to see if we have any questions coming in, because then we can answer your questions. You have us here now. Let us know if you have any questions.
I usually go on at night and like, well, I kind of go on whenever I can get a minute away from my children and if I don't have patients. But at night people are asking a lot. But again, I just like showing all the people and like, this is a wealth of information, this girl right here, and you're going to see her in Vegas. I go to Vegas sometimes when I'm not there. This girl's there every day and she's seeing the patients. So skin treatments. Oh, can you tell us a little bit about you want to talk, what's, I mean, either the chemical peel or the microneedling?
Yeah. Yeah, so I can tell you about both of those. And then also, really quickly, you were talking about like the hair health program that we have going on. And we were talking about how we want to do treatments that are safe for all skin types, tones. I just wanted to mention that that one as well is safe for all skin type or hair types.
Hair texture, yes.
Yes.
Yeah.
So with like the CeraVive hydrofacial, like the scalp facial, you would think someone like me, I've got my boho braids going, like, can I get that treatment? And the answer is yes. So we can go in between the braids, get to the scalp. I can still do the PRP injections. I can do like the CeraVive spray. I can do the Nutrafol. Like I can still do all of those treatments. And so when we say we want to have treatments that cater to everyone, we really mean it and about those things. But we don't want you to come and be like, oh, well, they talked about the hair health, but clearly that's not for me. Like it is, if you want a treatment, bring it up, express your concerns, and we have options that work for you. But let me talk a little bit about the BioRefill. I love that one. It's a pretty fast treatment. So as far as walking you through what to expect, you'll come into the office, we'll have you cleanse your face just to make sure that you don't have any like makeup on, things like that. We apply the BioRefill and we're just rubbing it into the skin. It's a little bit tacky and then it starts working. So there's kind of a two-step process with that one. It's going to exfoliate the skin and then also it's going to help to hydrate and cleanse and it gives like a really beautiful glow. It only takes about like 10 minutes for the treatment to take place. And then I really like that we can stack it with other treatments. So we can pair it with the Airlace laser if we're targeting other concerns as well. And then also with the skin pen microneedling. So to tell you a little bit more about that, with the skin pen, it's FDA cleared. So it's got a lot of research and backing as far as what we can use it for and what we can expect from treatment. And then with that one, you come in, again, we're going to cleanse your face. And we are going to apply some numbing cream to your face. We apply it for like 20 minutes. And that's nice because then it makes the treatment just like pain-free and comfortable. With that one, we're going to go in with the device and just take tiny micro channels into your skin. And that is going to trigger your skin to rejuvenate itself. So it's going to help with like acne scars, hyperpigmentation, fine lines, any texture concerns, dark spots, things like that. With those treatments, we can do the combination with the Airlace laser and the BioRefill, like I just mentioned. And then we'll always want to see you back with both of those treatments. It's not one that we just want to do once and then be done. You might see some results after the first treatment, but to get the full results, we'll want to do a series of treatments depending on what your concern is. And we'll let you know how frequently we need you to come back. With the skin pen, we don't say like, oh, I'll see you back in like 6 weeks. For the BioRefill, maybe we see you back in 2 weeks or a month. Same with the Airlace laser. If your acne is severe, maybe I'm going to have you come back in 2 weeks. If we're doing a little bit better, maybe it's 4 weeks. And then after that, maybe we're just doing maintenance. So we really have to tailor the plan with the different treatments to your concerns, your needs, and then what we're trying to build towards.
Yes. And I love all the skin treatments. I know earlier people were asking us about the downtime. with the laser. So we said there's no downtime with the laser. You want to tell us about the peel?
Yeah, so the peel, it's a gentle peel. It's kind of advertised as like a no peel. You can have a little bit of peeling, but it's not like a chemical peel where you're going to feel like your skin is just like shedding off like a snake, where you're going to have to hide and hold like away for, a few days. So after the bioretail, you can go back to work. You can go back to your activities and maybe just have a little bit of gentle peeling, which we love because it's supposed to be, no downtime. You can get back to your activities. With the skin pen microneedling, you can have some redness, you can have some dryness, and you might feel like you have like kind of like a sunburn type thing. But just little downtime with that. It's not significant either. So we like that you can incorporate these treatments into your daily life and continue on with the things that you need to do.
Yes. Yeah, I feel like I need to do the peel this week.
Yes.
Can you still hear me?
Yeah, it cut out for just a second, but I can hear you now.
Someone was calling. I love the peel right now because it's like kind of dry out. I like the peel because I think I get just like the quickest glow with that one. Mm-hmm. And I like that it's not super like irritating to my skin. When it is drier out, like right now with it being cold, my favorite is doing the hydrofacial, like the deep cleansing facial, cleansing out your pores, and then putting the peel right on after. I feel like that's the glowiest I get. But we do different combinations depending on the skin concern. So right now, last night I saw a patient, she came in and did the laser, the hydrofacial, and the peel all in one. And she's done like 4 sessions. She's been coming like every 2 weeks, and she just loves it. First of all, she's like, it's relaxing. It's my self-care time. But she's like, my skin is glowing. And you can just see, I'm like, well, like you can see the visible difference in the skin. And I think people get more excited about their skin health, like glowing and glassy, more than even the Botox and the fillers. They love anybody that has like just nice skin. This is the foundation. This is the first thing everyone sees. This is the largest organ of the body. So we really want to focus on that skin health. Again, offering treatments that are safe for all skin types and tones. And we say this, especially as women of color, like we've just been in this and we know not everything is created for black and brown skin. You can't use every treatment that's out on the market. And as we've seen, we show you all the patients that we see all skin types, all skin tones, all ages. Like we want to be able to treat everybody safely and get them excellent results. If you walk around our offices, you will see that girl's glowing. Everybody's skin is beautiful. Like people look natural, like our team, which is really important because people like, they're like, wow, you look normal. Like you don't look crazy. If I had crazy big lips and big cheeks, like, guys, maybe I'm not the right injector for you because that doesn't look natural. It depends on what your aesthetic is. So yeah, all of these people, we're doing the skin treatments. We're maintaining their skin health. We're not just here to like do some Botox and filler. We're thinking about you long term and like, again, largest organ of the body. We want to take care of this. We are doing this in the office, but then at home we set you up with the right skincare. And so we've got it over there. I have some I can grab here. We want you to use the right skincare. Sometimes it's our medical grade skin line. Other times it's prescription stuff or a little bit of both, depending on what your skin concerns are and goals. So acne, we treat a lot of acne. We treat a lot of dark spots. Acne, we're going to be using our laser. Like she was saying earlier, you might be coming every 2 weeks to get on top of it. I feel like 2 weeks for 2 to 3 months, then she's like, I got her. Yeah, this is our favorite thing. Once we get the acne, like 2 to 3 months of coming every 2 weeks, they're telling us, they're like, either my acne is not happening at all, or if it's happening, my breakouts are few and far in between. I'll get one around my cycle as opposed to my full face breaking out. So that's really exciting for people to be able to do this. And then you can just see their skin is glowing. You can see the texture is improving in their skin. So we can do that. The chemical peel that I was showing and that Samantha was talking about works well with acne too. Sometimes we're combining these. Sometimes we're alternating them depending on like what your skin can tolerate. That's how we kind of determine. And then at home, we might be doing prescription retin-A versus so this is going to help with acne, fine lines, pores, texture, dark spots, helping skin cell turnover. So we have that. We prescribe and dispense in the office. Other times, if if you've never used a retinol before, that might be a little too aggressive for you. So we'll start you with our Jossie line. This is Resurface RX, so it's a retinol. In there, there's some buffer, some hyaluronic acid. It's not so like hard on the skin as using just straight retin-A. We've got so different things. Our favorite one, this is wrapped. I don't want to open it up right now. I think our favorite like all-time seller from all of our patients is a Recovery Boost.
That's what I thought.
Yeah, this is like everyone's favorite. So this is very calming for the skin. We use it after all of our skin treatments. It helps reduce inflammation, any irritation in the skin. It helps hydrate, any redness, acne. I put it on my kids if they have little cuts. Just helps expedite the healing, and it's super hydrating. So that one we're going to be doing with acne because it's going to be reducing that inflammation, calming the skin down. Or after any of the skin treatments, we will do that as well. But that is one that like everybody, if they get that, they're like, that's the liquid gold. They just keep buying that one. And then the sunscreens, I'm like, we're not trying to overwhelm you here, but you gotta be wearing your sunscreen. So we have a tinted one, we have a non-tinted one, a mineral-based one. You need to be wearing your sunscreen and you need to reapply. Whether or not you're doing skin treatments. If you're like, I will never do Botox and filler and I'll never do laser, I'm like, you totally don't have to, but at the very least, like protect yourself from skin cancer. Use some sunscreen. This will also help with signs of aging, like dark spots and fine lines. So you have to use it. It's not enough to just do it in your makeup. People are like, oh, it's in my makeup. I'm like, that SPF 15 is not doing anything that you applied at 8 a.m. and then you're driving around Vegas or LA in this hot sun.
Especially like here is different.
It's different in Vegas. I feel like when I go to Vegas, I'm like, the skin on people, I'm like, we've got to work on the skin. Mm-hmm. The people look very weathered because they have so many lines and it's sun damage. So I'm like, use your sunscreen, reapply it. So I'm like looking at all the skincare products. I'm like, I love all of them, honestly. I can talk about all of them.
Yeah, no, they're great. And we talked about doing our virtual consults and even our in-person consults. Like that is something that we will go into like a lot of detail about. We're asking you like, what cleanser are you using? What moisturizers? What serums? What's the ingredients in them? And we need to know because if you have concerns, are these ingredients in your skincare line helping or are they making problems worse? If you're going to pursue one of our treatments that we talked about, like the laser or the skin pen or the peels or the hydrofacial, then we need to educate you on when some of these products need to be stopped beforehand and when you can resume them after. And then if you need help as far as like switching out some products that you just saw on like TikTok or you picked up on Instagram or wherever, then we have the full line to tell you, we know that this Pure Cleanse is kind of tried and true. It works well for everyone. So, we'll ask you a lot of questions about it. And it's because we want to help you get the results long term by pairing like what we're doing in the office with what you're going to be doing every day at home. Because I feel like that's a really important step that people often miss. Like your AM routine, your PM routine, like that is your base right there. And then we just want to add to it.
Yes. So yeah, you guys can tell we can both talk a lot. It's just, we're super thorough. Like she's saying, when we do these consults, we do the virtual consults for just about everyone we see. We also have, like she mentioned, the in-person consults. I will say majority of patients will do a virtual first. We like to do this. We go through your questions, your goals, give you tips on what to expect, how to prep for treatments. So then when the patients show up to office, like they're ready for their treatment. They already have stopped their blood thinners and the alcohol. They took their arnica, their pineapple. They know all the things. They have planned that this is a good date for them in case they're bruised or swollen. They've been out of the sun. They've stopped their actives. They know everything. So when they're there, they're able to go forward with the treatment. During these calls, us going through, like she said, we're asking a lot about your history. What have you tried? What has worked? What hasn't worked? What are your concerns? What do you do for work? All of that kind of helps us because I will walk into a room and I will treat a pastor and then I will go to the next room and I will treat a sex worker and they can have completely different aesthetic preferences and then a teacher and then a social worker and then all the different things. And so we're asking questions about like, oh, you're an actress. Okay, you might still want to have some like frown lines. So I don't want to freeze your face. Oh, you're a sex worker? Okay, well, I get it that you might want to have like a little bit more juicy lips. So we ask a lot of questions to make sure that these treatments are going to fit for you and your lifestyle. And we are real with you about expectations and limitations of the treatments. We're not here to be like, yeah, you should do this. That is not it. If anything, we probably tell people no more often than not. Like, no, I don't think that's right. Hey, maybe get a consult for this, or what you're describing, realistically, we won't be able to achieve. If you're saying, I only want this, and I want you to get rid of all of, like, just make this all the way tight back, we're going to be like, well, you can't do that with Botox and filler. Like, here's what it can do. We have photos to show you of patients and say, hey, this is what they did, and they have a similar concern to you. They look like you. Here's this result. Do you like this? Do you want something more dramatic? So we go through all of that. The virtuals are really, really good. We're able to have a really thorough assessment and can make a treatment plan. So we start developing your treatment plan on that call. And then when we get off the call, we write notes about it. And our team sends you information about everything we talked about. We send you information on pricing. We send you information on financing. So if you're like, hey, I want to break this up into payments, we can do all of that. But that way people aren't just like walking in and like, what is this? What's going to happen? What am I going to do? Or a lot of times, like you said, people will think that they want this treatment, but that's not actually the treatment that's going to get them the result they're seeking. So that's where we're able to give some guidance during these consults. And they're excellent. Like the patients come in, like when they come into clinic, we already have like this baseline. We know them already. And so we're like, hey, we're able to maybe go a little bit more deeper. Maybe we can touch on you and say, hey, I know I said, between 2 to 3 syringes. Actually, when I feel on you, I'm thinking we might just be on the lighter edge, or we're going to break this up to a couple sessions. But what we say on the call is pretty close to what we end up doing in the office.
I agree. I feel like it can be less overwhelming. So if you are new to this entire world and you're hearing all of these treatment options and it feels overwhelming to you, I feel like the virtual consult is an easy way to kind of step into the world. You just do it from home or your car or wherever. We have people call from wherever. You get to talk to us one-on-one, and it just feels a little less stressful, right? And then we give you the plan, or we start the plan on that call. So if you want to do more research, you can say like, oh, Samantha recommended this, we send you more information, and you can study up on it. And then when you come into the office, you have an idea of what questions that you have that I need to give you more information about, or what concerns you have. And so I like that it's just like a nice way for you to step into the world if this feels a little bit overwhelming to start. Like we want to make it like an easy kind of stress-free process for you.
Yes, we want you making informed decisions. That's like the biggest part. Like we're not trying to have you make rush decisions. If you're asking us, should I do this? Should I not? We're going to be like, no, go think about it some more, or go research it some more. Like we're not here to like, yeah, do it, girl. Like that's not it. Like that's just not our style. Again, there's no rush with these things. We're with our people forever. We see people from all over the world. Every day I'm in clinic, I see somebody from outside of LA, outside of California, outside of the United States that come with their bags. You saw somebody, I think, from Arizona yesterday. And she's Vegas. Yeah. So we see patients from everywhere. We want you to make informed decisions. We want you to be prepped. We're not trying to rush this. So before she saw her patient from Arizona, they had already done their consult. They already had the treatment plan. They are like all the info was sent. And then we already started developing that timeline of like, okay, especially for our people that come from outside of LA and Vegas. Okay, we're going to see you this day, and then we're going to see you back in this many months or this month. Like we go through that so you can start preparing. We also want to know if you're getting ready for something. So we ask questions like, are you getting ready? Are you prepping for an event? Weddings. We want to be doing this months in advance before a wedding. We ask questions about you. Travel's a big one. Your lifestyle. Are you losing weight? Are you planning to lose weight? We're asking all these questions so we can gain this information about you. And then we're going to say, if you're telling us you're going to be losing weight, we're thinking in our minds, okay, your face is likely going to change as you lose 50 pounds. So I can, but like I don't want to just go and do your full face of filler today because your face might be changing over these next few months. So should we wait? Should we just start light? These are the conversations that we're having when we're approaching your treatment.
And I feel like in Vegas, maybe we haven't advertised that as much or just talked about it, but we do the medically guided weight loss. So you can come see me. We'll do a really detailed consultation. We can get you some prescription medications that can assist in your weight loss journey. And then week by week, you come in, you meet with me, we go over how you're feeling, how your side effects are, how are you losing the weight, things like that. So that's something that, oh, there she's going. She's got the
I know. You're saying all the things, I like grab them. I'm like,
like so if that's something that you're interested in and you want someone to tailor a plan to you and be able to see you frequently and kind of guide you through that journey, come see me in Las Vegas. We can help you with that.
yes. So like you said, medically supervised, we do weight loss and wellness program. We use Zepbound in our office. This is a medication that helps people with weight loss, appetite suppressant. You do them on a weekly basis. So before we just start poking you up with shots, guys, you know we're thorough. We're always just extra. We're gonna do things the right way. Like that's just what we do in this office. We draw your blood work. We go through your health history, your medical history, make sure that you are a candidate to do these treatments. So we get your labs. I know, people are like, well, I can just get it offline. I'm like, you totally can. But I will tell you, the patients that come into our office, they love coming. One, they keep the weight, like one, they're doing it safe. They're doing it with somebody that's helping them. Because I have heard some crazy stories ever since these came out from people that have like tried it on their own. One of our patients told me, she was like, my mom gave me my dose and she gave me 10 times the amount that I was supposed to get. And so she was like, I was in the hospital for 3 days. That was 4 months ago. She's like, she's like, my bowel movement, she's like, nothing is the same since then. So a lot of people don't know what they're doing when they're like dosing these. I have other people will tell me, oh, I got it from my friend's sister's boyfriend in the back of his car. I was like, what is that? Like, what do you mean? And like, but the big thing is people don't know how to dose it. They don't know how to manage side effects. They don't know any, like they're just kind of taking these shots. And I'm like, that's not how it is. So again, we're extra. You come in on a weekly basis. We can, after we've seen you and know what's going on, we can send some home with you for 2 to 3 weeks where we teach you how to self-administer. But I will say most of our patients like coming in. They feel like it helps them with accountability. Because when we're in here and we're asking them like, okay, let's talk about what was your diet this week? How are you doing? We're doing a weight check, but we're not super concerned with the number on the week to week basis. We're looking at this like, over a month basis, like long term. But we're asking, making sure you're having side effects. You feeling nauseous? Do we need to call a prescription in for you? We can get that for you. How are your bowel movements going? What is your exercise like? Because we don't want to just give you these shots and then you're eating donuts and pizza and fried food and not making lifestyle changes. We're really trying to help you to have lifestyle modification so that you can keep this weight off. If you want to stop the medications, you can, or we can be reducing it to just like a maintenance dose where you don't have to be taking a high dose every week. A lot of our patients, if they've got to their goals, we might see them on a monthly basis every 6 weeks, something to like give them a small dose just to kind of help. They're like, oh, it just helps like curb the food noise, the cravings, but they're not having to come on a weekly thing. So our patients really like it. Even though I'm like, hey, you want me to send it home with you? And they're like, nope, I want to come in and see you. I want to see you next week. Yeah, and they like it. And then they start getting excited. Like they see the changes and they see how they feel when they're losing weight. I have my brother on it. And he's still on it right now. And he lost 35 pounds, and he's been doing it since July, August, September, October, November, so 4 months. And he was just like, he was getting ready for his wedding. He's like, I had to keep getting I had to keep buying a new shirt because the size kept going down. And he's like, I just feel better. I don't have like weight on my knees. He's like, I can like move around just easier. I have my aunt on it, and she lost same sort of thing. Like they have energy. They're just happier. Like, but she's lost like close to 50 pounds. So we've seen people lose weight. We've seen people's lives improve, like change their lives for the better. But also there can be changes with like the skin, the face. And so we can help with that whole part. When people lose weight, they're also losing fat in their faces. And so then they'll come in, they'll be like, I lost 30 pounds, I lost 50 pounds, but like also my face looks different. What can we do here? So sometimes we're starting collagen stimulators or the natural filler earlier on into their weight loss journey before they get all the way sunken and hollow. Like we're doing little bits to help maintain their skin health throughout the process and the volume.
Yeah, and my favorite thing is, as you talked about or mentioned, it's just that kickstart, right? Sometimes you need just like a little help, a little motivation. Maybe the food noise goes down, you start having less cravings, and then you really want to get in control of your diet. You're picking more fruits and vegetables and good proteins, and then you have like the energy to start working out more, get into like a routine, you're drinking more water, and then maybe your friends, your neighbors, everyone starts to notice that you're doing better overall. And one of my favorite parts is just like the confidence. You see people step into this new confidence and then they're able to show up for other people better. And so I love being able to serve like our patients, our clients, and then watch them better serve the people that are around them. So it's more than just like, oh, we're going to do like a quick injection, you might lose a few pounds. Like we really want to see that full transformation as far as you taking charge of a part of your life that's going to give you those better health outcomes long term.
Oh, I love that. Cool. Okay. So if you guys have more questions, like whenever Samantha, if I can ever grab a girl from the team, I will totally do it because I want you guys to be able to see them. Like these girls are excellent, as I've told you before. They have their own. They're seeing all their patients. Their patients love them. I'm like, read the reviews, guys. Yes, we just switched the name to Jossie Skin and Wellness. It's been under my name, Janelle Beauty Aesthetics, since 21. And so if you like want to read reviews, I'm like, search under my name or search under Jossie. It's saying, let me make sure I'm still live. But you can read reviews. You can look at the patient photos. We have thousands of patients that have like consented their photos for us to share. So we can show you. We got a picture of we got pictures that's going to look like you. We can show you different faces, different skin types, all the things. Like we can show you those, read the reviews, don't rush it, do a consult. You can book your consults at the top of our page, and I need to make sure it's on our Jossie site too, but we just updated a new website, and so the booking is super easy and straightforward. You can do your virtual calls on there. If you want to book an in-person consult, you can, but again, unlike the virtual ones, the patients come in better prepared. It's just better because if they come in and they haven't really done their research and they're just like, I'm here. I'm like, well, you could bruise. And like, I don't want to bruise. I'm like, well, you can. They're like, well, it's my friend's party tonight. I'm like, we shouldn't do this today. So it's just something we wanted to have you prepared for your appointment. You can book those at the top of my page or the Jossie page. You can send messages, but sometimes like we just miss them because we're seeing patients and doing all the things. But if you text the number on our top of our page, you can also, the team will see it and they can help you with coordinating. If you're like, I can't figure out how to do this consult thing, they can help you with coordinating that. So always, like we're here, we will be live more often to answer your questions. Always send them through. We also sometimes have people will join and like share their faces and ask their questions on live. We'll go through the patient photos. We like to show different faces. I always talk about the treatments I've done, because I've done a bunch. Samantha can talk about hers. Like we love the treatments. Like these are things that we love and that we do. And if we didn't love them, I wouldn't be showing them to you guys. We want you to have the best possible outcome, and that is like what we strive for. We ask a lot. We ask a lot of questions with you. This is definitely a partnership that we have with our patients. It's not just us telling you what to do. It's us having a conversation and developing that treatment plan, working on your treatment plan together. So yeah, if you have any questions anytime, please let us know. I don't know, Samantha, if you had any other things to add, you can throw them in there.
I think so. No.
Thank you so much for, I texted her today. I was like, can you meet today at lunchtime? So I appreciate you for joining. And I'm sure you will see her on more or watch the Jossie page when she has time she can jump on. It's us and like, we both have 3 kids. So between our family life and patience, that's when we will jump on. We appreciate you guys so much. Thank you. If you have anything else, let us know. I hope you have a great day. God bless you. Bye.